Hi again, this is Carissa Shaw. We're continuing on with part two of my community assessment. So now we'll talk about community assets. Bristol County has a total of 16 hospitals. They include emergency acute care, psychiatric rehab, and state-run facilities such as the Taunton State Hospital. Um, and then they also have 126 public schools and 18 private schools, which include primary, middle, high school, undergraded, special education, alternative schools, and vocational schools. And then there's also private schools that are mixed up with mixed grade levels, Montessori schools, special program emphasis, special education, and early childhood. And there's also 6 colleges and universities in Bristol County. Bristol County also has 78 Catholic churches. And lastly, there is 12,074 clients in support programs. These support programs include adult behavioral health, acute care, child family run services, rehab and recovery, housing, community housing, and other community support systems. Some of the health indicators for Bristol County include Medicare patients, diabetes, smoking, motor vehicle accident deaths, breast cancer, heart disease, infant mortality, mental health, and body mass index. In terms of Medicare, for the Medicare enrollees, most of them are enrolled for congestive heart failure, pneumonia, and acute heart attacks. Diabetes, smoking, and motor vehicle accidents have the second highest prevalence in the entire state of Massachusetts. In breast cancer, for every 100,000 women, 125.3 women are diagnosed with breast cancer yearly. In terms of heart disease, 5.1% of the adults in the population of Bristol County have heart disease. And for infant mortality, 5.8 out of 1,000 live births end up passing away before their first birthday. The suicide rate in Bristol County is 9.6 per 100,000 individuals, and the BMI rate is 27.9% of adults in Bristol County consider themselves to be obese. So the priority health issue is actually adult obesity, and they are tied with the highest prevalence in Massachusetts to be first. The trend is actually worsening, and it can lead to other chronic health issues. This includes hypertension, heart disease, type 2 diabetes, liver and gallbladder disease, cancer, respiratory issues, um, osteoarthritis, sleep apnea, and then just overall poor quality health. Some of the factoring data includes inadequate fruit and veggie consumption, lack of exercise, and mental health issues. Some of the community resources are Mass in Motion, CORD grant funding, and initiatives to build on environment. Mass in Motion provides community-based wellness grants, and it's basically just a statewide obesity prevention initiative. Court grant funding aims to improve nutrition and exercise at childhood levels. And then the initiative to build on the environment is just to kind of increase availability for people to get exercise in, like adding healthy, safe routes to walk around town, and then even improved public transportation. Some of my recommendations I would include our public health informational events that could be held once a month just to kind of inform the public on what's going on. The next one would be to get schools involved. Informing kids at a young age would help them in their future to eventually lower the risk of adulthood obesity and maybe even eradicate it in the future. And the last recommendation I would make is to have specific policies for each specific public health issue. That way, each one can get addressed correctly and properly. So that is it. I hope you enjoyed learning about Bristol County, and I look forward to watching some of your presentations for everybody else. Thanks. Bye.